Today I'm going to talk about foot dynamics in patients undergoing anterior cruciate ligament reconstruction with the peroneus longus graft. So we all know that ACL is one of the commonest injuries, especially in young athletes, and an important decision must be made regarding the graft choice prior to surgery. So we have got two graft options, allografts as well as autografts. Allografts, the theoretical advantages are elimination of donor site morbidity, reduced pain, shorter operating and rehab times, and better cosmesis. However, they are not easily available and often difficult to procure, carry higher costs, and could be associated with immunological reactions. Whereas the commonly used autografts that we use in ACL reconstruction surgery are the hamstring grafts, the bone patellar tendon bone grafts, or the central quadriceps tendon. An ideal autograft donor should have an acceptable amount of strength, be of adequate size, and be easily and safely harvested. And there's a precedent in the literature suggesting alternative autografts for ACL reconstruction, such as the peroneus longus tendon. Recent studies have reported that the PLT graft, that is the peroneus longus tendon, had maintained a potentially better ACL substitute for its tensile strength and regeneration ability after being inserted post-surgery. It has been used as an autograft for ACL reconstruction with good clinical outcomes and low donor site morbidity. In biomechanical and kinematic studies, removing the entire PLT had no effect on gait or ankle stability. Studies have shown that there is no significant difference in the tensile strength of the hamstrings and the P longus tendons. Hence, we conducted this study to assess the foot dynamics in patients undergoing arthroscopic anterior cruciate ligament reconstruction with the PLT graft using the clinical foot and ankle scores. So, a study was conducted at Bharati Vidyapeeth Medical College and Hospital, Pune, in the Department of Orthopaedics, and a total of 42 patients were recruited for the study. The study period was from October 2019 to September 2021. Patients above 18 years of age were recruited for the study. Patients in whom graft other than the PLT was used were excluded from the study. Informed consent was taken and ethical committee approval was taken before the commencement of the study. So, the constant American ankle and foot scores were taken pre-operatively at 3 months follow-up, 6 months, and 1 year after surgery. So this is what the score looks like. So the present study aimed at evaluation of foot dynamics in patients undergoing ACL reconstruction with the PLT. The mean age of patients was 32.2 plus or minus 7, including 29 males and 13 females. Most of the patients had an isolated ACL tear. Some patients had an associated meniscal injury, while some had an associated collateral injury. The clinical foot and ankle score was evaluated. The score was recorded pre-operatively and then at 3, 6, and 12 months follow-up. The pre-op score was 100 in all patients, which at 3 months declined to 90 among 13 and to 80 in 2 patients. The pre-op mean score was 100 plus or minus 0, while at 3 months it was 95 plus or minus 5.8, 6 months 99 plus or minus 2, and at 1 year it was almost back to normal. An additional assessment was done to assess the arch of the foot. Out of these patients, as you can see in patient number 1 of them had a slight loss of arch but did not show any functional impairment. For the rest of the patients, there was no change in the arch of the foot, and representative footprints of 3 patients are depicted here. So I'm not going to go into the details of the surgical procedure, but the important point here is identification of the peroneus longus tendon and to differentiate it from the peroneus brevis tendon. The peroneus brevis has got muscle attachment, so you isolate the peroneus longus tendon, you harvest the graft, you stop around 3 finger breadths before the fibular neck to prevent injury to the common peroneal nerve, and the remainder of the stump of the peroneus longus tendon and the peroneus brevis can then be a tenodesis can be done here, a side-to-side tenodesis. So we all know that many graft options exist for reconstruction of the ACL with injury-specific and patient-specific considerations that need to be made during the pre-op planning. The bone patellar tendon bone autograft, while having the longest history of use, has its own complications like anterior knee pain, especially in patients who spend a lot of time on their knees for their culture, job, or sport, and less commonly can be associated even with a post-op patella fracture, fat pad fibrosis, or a patellar tendon contracture. The hamstring tendon autograft is probably the most commonly used, but there have been some studies which have shown a significant loss in the hamstring muscle strength and some medial-sided instability, especially in the presence of an MCL injury. The use of peroneus longus is a recent development in the field of ACL reconstruction, and it is a safe procedure with an excellent outcome. Chow et al. In their study found that peroneus longus is a good substitute for ACL reconstruction and that its resection has no major influence on the ankle joint. A previous biomechanical study with the same cross-sectional surface area reported no significant differences in the tensile strength between the 2-strand P longus and a 4-strand hamstring. Kermoglu has done a lot of research work regarding the PLT, and he has shown no patient experienced ankle foot joint dysfunction based on AOFS scores. Ratomi reported similar outcomes as compared to our study. The peroneus longus main function is to evert the foot and plantar flex the first ray. There is concern that the removal of P longus will, in addition to decreasing the eversion strength and plantar flexion, will increase ankle instability. However, Fu Xiongxi in their study showed similar strength and range of motion of the ankle pre and post graft harvest. Another landmark paper by Kermoglu also demonstrated no obvious influence on the stability of the foot after harvesting the PLT. Similar studies by Zhao et al. Showed good AOFS scores pre and post operation. One study by Zoshi et al. Reported good AOFS scores at 18 months follow-up. They also checked the arch of the foot, and they also checked the ankle stability by doing the anterior and posterior drawers test, and found no difference from the contralateral limb, and none of the patients had any complaints pertaining to the ankle joint. A study by Trung et al. Has a similar cohort as ours and has associated injuries as well, and they had a 1-year follow-up and showed similar AOFS scores compared to our study. So there has been some discussion regarding the regeneration of the peroneus longus tendon, and does it really regenerate after harvesting. There has been some documented evidence as per some studies, such as this one studied by Kermoglu and Kosuscu, where at a 15 months follow-up after the primary surgery, the PLT showed some regeneration in the MRI scans. Another study showed good PLT regeneration 1 year from the time of harvesting in a cohort of 25 patients. Our study does have some limitations. The cohort is small because only 26 patients reported for a 1-year follow-up. We would probably recommend a longer follow-up for long-term results, and a formal gait analysis could be supportive along with isokinetic muscle testing. But the early results of the peroneus longus tendon look promising, and there seems to be no significant effect on the ankle function and foot stability. The peroneus longus tendon seems like an excellent graft and a safe and effective alternative graft choice in single bundle ACL reconstruction study. Thank you very much.